enough to do those soon. We've been told by all of our federal sources that we can probably expect some type of vaccine product to be available by the end of the year, but it will not be available in sufficient numbers to meet the demand. By the spring, we hope to have a lot more vaccine available, and it's possible that we could start having large amounts of vaccine at that time, or perhaps might be a little bit after that. At any given time, we may have as many as 6 or 7 vaccine products all on the market all at once, and again, different products will be applicable to different populations. Those products are not going to be interchangeable, we think, for the most part, and so it's going to be very important for people to know which vaccine they get, because many of them or most of them are going to require multiple shots, and so whatever vaccine you start your immunization process with is the one that you would want to finish with. So in order to track who gets vaccines and where they go and which individual products are needed for a given person, there are going to be tremendous IT requirements in order to keep up with all that information. And Alabama, as you know, has an electronic immunization registry. It's known as Imprint, that's been used for many, many years. It's used widely by pediatricians and by people who are giving shots to school-age children as a way of tracking, how kids get vaccines. It's certainly used by many providers of adult medicine as well, in a lot of cases. But it's going to be very crucial to the COVID vaccine effort. So we're working very hard to try to recruit people into Imprint to get them signed up and available and ready to go. So there's a tremendous IT effort going on with that as well. I touched a few of the items on that page, and really I wanted to, we'll be glad to go back to any of these if you would like, but I wanted to skip really to the next to last page in your handout, just to sort of show you some information about the vaccines that we can expect. There are multiple different mechanisms for how vaccine technology can be implemented. The vaccines that are sort of quickest and easiest to make and can be produced in the largest quantities in the quickest way are on the left side of your sheet there, and these are DNA or RNA vaccines. These are vaccines that use molecules of DNA to stimulate a certain immune response, so that your body's immune system identifies and recognizes a pathogen and is ready to respond right away. This is the basis of the Mrna Vaccine that you've heard so much about, which is one of the first likely to come out. These mRNA, that's an mRNA vaccine, it's called, and this is a new technology. This technology has not been used before for vaccines. There's a lot of sound scientific basis for why we think it'll work, and there's a lot of data so far showing that it produces a very good immune response. But this is new, so it will come out almost certainly first, because it's just so easy to scale up in large numbers. The production process is really straightforward. But there's a lot less known about these vaccines, and so that's been certainly part of the issue. On the far right there, you see what the mention of viral vector vaccines. This is a technology that's been around a little bit longer. This uses a type of virus that's been weakened to introduce genetic material into the body. It's the basis of the Ebola vaccine, which has been around for just a few years, although not widely used. The Astrazeneca vaccine is one example of this. The Johnson & Johnson vaccine is a little bit different, but is also an adenovirus vector vaccine. It's the one vaccine at this point which we think could be a single shot as opposed to multiple shots. But this technology has been around a little bit longer. These vaccines are going to be available soon. They're not quite as easy to produce as the mRNA vaccines, and they're going to come out a little bit later. There are a couple of other things there that we can discuss, but the one next to the right side is the subunit vaccine, and the subunit vaccines are really probably the ones that we all have the most experience with. Subunit vaccines have been around for decades. They're known to be safe in just about any situation. We don't have a lot of question about whether they'll work or not. They almost certainly will. They'll almost certainly be safe, but they take a long time to produce, and so they're not going to be widely available right away. But hopefully, sometime in the next year, subunit vaccines will start rolling out, and then we'll have those available. So there's a little bit more information there. Again, we can discuss kind of as much as you would like to, but we have. Anyway, a lot of other things that we can talk about. I did want you to know a little bit about our plans for flu season, because flu season serves as an opportunity for us to not only roll out flu vaccine, because we need to do that, but it also serves as a good way to plan for how we might roll out a COVID vaccine, just in terms of the logistics of managing that. Public health gives out pediatric vaccines in large numbers and has for a long time. Adult flu vaccine we certainly have available, but we don't typically administer in large doses simply because there's so many other locations and opportunities for people to receive adult flu vaccine. However, this year we are going to be receiving somewhere between 10 and 15 times the number of influenza vaccine doses than what we would normally have. And that is going to be made available through our county health departments, but also through other providers that we recruit to help us do that. And that'll be, in a way, sort of a trial run for how we're going to do this. So we do have some staff here that can answer questions about that, but and we'll be glad to let them speak as well. But I just wanted you to be aware that that's one of our big planning efforts. So